Welcome back. Almost every state is reporting a drop in the rate of low-income adults who are uninsured. The sharpest declines are seen in small towns and rural areas.
2015 to 2016 saw actually a 19% drop in people who are uninsured nationally. That's according to a Georgetown University report. That report says an expansion in Medicaid is the reason for the drop. An early adopter of Medicaid expansion was Kentucky. Paula Suro tells us about the impact it's having on that state.
The one medicine I was on was $2,985.19 a month, was my first chemo medicine. There would be no way I can afford that.
We spoke to Pauline Creech back in January as she was battling leukemia and relying on Medicaid to pay for her medicine.
It's the most important thing to me right now. It really is.
She's one of 1.4 million Kentuckians receiving Medicaid benefits, but that number used to not be so high.
It's kind of a cool graph that shows what has happened with health care coverage since 2008. And you can see the rate of uninsured starting in 2011. This is for all of Kentucky adults, plummeted from 32% to 13% uninsured.
Dr. Lynn Sadler, District Director of Health for the Northern Kentucky Health Department, is backing up what a new Georgetown University study found. Medicaid expansion changed the outlook for low-income, uninsured people in Kentucky, especially for those in small towns and rural areas.
Rural areas tend to have higher uninsured rates in general than more urban areas. Many people are self-insured.
That's why Grant County, one of the rural counties NKY Health oversees, saw a large decline of uninsured people, going from 22% to 7% according to the county health rankings.
We know that unemployment rates tend to be higher in some rural areas. And in our country, pretty much healthcare coverage, insurance has been tied to employment. In those situations, you're going to find that people don't have access until the Affordable Care Act came along.
The study showed the uninsured rates for low-income adults in Kentucky as a whole fell from 40% in 2008 to 2009 to 13% in 2015-2016, reducing the gap between uninsured people in metro areas versus rural communities.
And it's because of those numbers in the expansion of Medicaid that NKY Health predicts that as a result, they will see fewer illnesses.
We shouldn't be seeing as many heart attacks or strokes.
Paula Suro, 9 on your side.
For comparison, Ohio saw a 21% decline in uninsured low-income adults from 2008 to 2016. Kentucky saw a 30% decline in the same period. Right now, because of a budget shortfall, Kentucky Governor Matt Bevin is proposing a plan to overhaul the state's Medicaid program to include certain requirements for benefits.